Welcome to the Divine Lifestyles Podcast. I'm your host, Tara Magalski. Together with my guest experts, I cover topics ranging from cutting-edge healing modalities to hormonal harmony, to nutrition and plant medicine, to mindfulness and spirituality. My goal is to educate and inspire so you can create your own divine lifestyle. It's time to dive inward, rewire your brain, and heal from the inside out. I've got an exciting offer for all of my listeners. The free Divine Daily Practices video series. Get simple practices to release anxious thoughts, sharpen your intuition, and rewire your nervous system in less than 10 minutes a day. Come on over to my website at divinelifestyles.com/divine daily practices. And over the next week, you'll receive a complimentary self-care system to drop into your authentic self and activate your divine intuitive wisdom. I hope you enjoy. Welcome to the Divine Lifestyles Podcast. I am your host, Tara Magalski, and today's guest is Dr. Stephanie Lyn Coleman, a board-certified physician who's completed her medical training and residency in New York and Boston. Woo woo! I lived in both places. My husband's from Boston. And now you're in LA, where you have become more interested in integrating holistic, integrative methods of health and healing into your practice. So I know that you're a Reiki master, a certified health coach. You studied all different types of integrative medicine techniques, and you have trained in psychedelic assisted therapy. So thank you so much for being here.
Thank you for having me. And actually, I'm in Salt Lake now.
Oh, you're in Salt Lake now.
Still, but I have opened a practice in Salt Lake, so I'm here primarily.
Amazing. Well, thank you so much for being here. You're like the perfect candidate for my podcast. So I was so excited when your team reached out. I want to just jump into it because I know you've been practicing with ketamine therapy for the past 4 years. And then you founded Journeys in Utah. But what was your journey to the medical field, and what inspired you to transition from this traditional medicine to more holistic?
Yeah, so it's kind of a lot of left turns in that path. But I mean, really the reason I got into medicine originally was to be a surgeon. I love human anatomy and I love physiology. And I think it's pretty amazing that our bodies function without us having to think about it. We think about some things and do some things, but we don't think about how we're breathing or how our heart is pumping. So I got into med school, wanted to be a surgeon, realized that maybe in the long run, that's not quite the life I wanted. I ended up doing radiology and musculoskeletal radiology, so sports medicine type radiology. And I love that still and do a little bit of radiology, but really it just didn't feel satisfying to me. And, if you've ever spent time in the healthcare system from either patient or provider side, you realize it's kind of a broken system in many, many ways. And I really started my own personal work with psychedelics probably 8-ish years ago now. And that's kind of got me into that space. But just even moving to LA after finishing residency in Boston, I got kind of more was able to see more types of healing practices, right? So I doing my training in Boston is a highly academic medical space, and I'm grateful for that training. And LA is a bit of a different bird for a lot of reasons. So just kind of exploring in kind of the Reiki space, the energy space, integrative medicine, acupuncture, all of these things that were kind of less prominent, obviously, in my training, kind of opened my eyes and broadened my horizons on how we actually start to heal ourselves. So once I kind of started doing my own work, I got interested in looking into doing the MDMA training with the MAPS organization. It was clear back then that it was going to be a longer road than probably they were expecting, as we have unfortunately been seeing. And as a result, a friend of mine had just done a ketamine training, and I didn't know too much about ketamine particularly. So I was like, cool, let me go do that. And it was actually pretty phenomenal for me. I mean, the training in general is really beautiful, but Using intramuscular ketamine as we did, because it was experiential, it was one of the first times that I was able to kind of fully let go of control in a psychedelic space. And I really got to see kind of the power of this medicine for myself, but also watching what happened with other people. So really, after I did that training, I kind of quit my full-time job in radiology in a few months, and then started my own private practice doing ketamine therapy in LA, which is now, that was probably like 2020, the early 2020. So yeah, it's been like four-ish years.
Yeah. Gosh, there's so much to unpack here because I'm familiar. I facilitate with psilocybin
Mm-hmm.
and breathwork journeys.
Yeah.
And I have a friend who was doing some ketamine
Mm-hmm.
therapy, and I know that there's so much controversy around this. And I also, like, my husband has done a lot of different things in Iboga, and he's done it more on the jungle side. And I know that you can do it in like a controlled environment where it's like, so I just find it all super fascinating that we're like bringing these things into therapy. So I have a lot of questions because I've had experience with ketamine
Okay.
as, like, an extracurricular activity.
Yeah.
And it's
Would you
not
call it
something
social use?
for social use. And I actually like find it to be like a little scary,
Mm-hmm.
because I've seen people go into K-holes. I have seen people almost like die,
Yeah.
and like complete dissociation.
Yeah.
So it's actually never been anything that I was like super into. So I was like wanting to have this conversation because I would love to kind of understand like the benefits that you're seeing
Yeah.
with it.
Yeah, and I think, there's a lot of people who are using ketamine in a more social space. And personally, I don't fully understand it, because to me, what I see with ketamine is it really turns people internal. It doesn't feel like so much of a social drug to me, but that will somewhat depend on the dose. And yes, it can be dangerous in the sense that if you are going on a higher dose and you end up in, what people call a K-hole, you're pretty vulnerable if you're in a public space. Like, you don't really have any idea what's happening around you. And so that's where, it can be used in ways that, could put people into real harm. So that's a concern. But ketamine is such a good drug, and it gets such a bad rap.
That's
Besides,
funny.
yeah, it's it's the bad one. But it's so good when used in an ethical like way, and really intentional. And social can be
Yeah.
intentional. Like, the social use
Mhm.
of drugs with people that creating connection, and kind of that is very much an intention. It's just, do we have that intention or not? But for me, when I work with ketamine, what I see is that, depending on the type of people I'm working with, LA is a little bit different type of person than Salt Lake City. We have a little bit different populations, but it helps with anxiety, helps with depression, helps with trauma, right? So we like to do, well, research is done really around one specific thing. Like, we have to be very clear when we do research studies that we're studying this is the way we're doing it, and that's it. But, if you think about mental health as a more general thing instead of like specific diagnoses, I like to think about mental health as more of, everything's a little bit trauma based, in the sense that, like, the human experience can be traumatic. And I use the term trauma quite loosely, intentionally, because it can look like many different things for many different people. But that's kind of, to me, source. And then from there, we have symptoms, right? So your symptoms may present like depression. My symptoms may present like anxiety. So it may look different for different people. But what I really see that ketamine is doing, and for the most part, psychedelics, although they do it in different ways, is that it's really repairing relationship with self, right? So all of our relationships external to us are just mirrors of our relationship with ourself. And as we
Mhm.
experience different traumatic things in life, the self gets fractured. And we can talk about parts of ourselves and parts work, but we kind
Mhm.
of develop these parts to protect ourself, which kind of got damaged as a result of something that we were exposed to or happened to us or didn't happen to us. And what ketamine does helps us to kind of bring those back together and kind of really recognize who our self is, and like feel safe in that. And ketamine does have, it's termed a dissociative anesthetic. I often try to not use the word dissociation because it has such a negative connotation in the mental health space. And nowadays it's pop psychology, right? Like, oh, I'm dissociating. Everyone's dissociating. But, it's in the sense that, like, to me, what happens is a lack of awareness of body, right? So instead of using that like dissociation term, I'm like, you won't be so aware of your body. Half the time we're not fully aware of the body, but we are sort of. And this is like, you're not. And you sometimes don't even care if you have a body. And so like the thought is like, well, does that make dissociative symptoms worse? And actually in ketamine, it doesn't. It can be really helpful. The body can feel very unsafe for people, especially if you've had some type of maybe sexual trauma or something that just makes you leave your body overwhelming. And some of the other medicines, MDMA, plant medicine, can be very body heavy, and it can feel not so great for people, it can feel overwhelming. Ketamine kind of takes that out of it, right? So it allows us to kind of be out of our body in a way that isn't kind of overwhelming. But then when you come back into body, it kind of like gently puts you there. And in a way that people, the contrast allows them to actually understand what it feels like to feel embodied, because most people aren't really clear on that, and in a safe way. It's
Hmm.
what I see with ketamine, and I don't have the quite science for this because it's not how we describe what happens, but it tends to take down the amygdala, like the fear center,
Mm.
similarly how MDMA does it, just different mechanisms. And so it allows people to kind of be with some of these more challenging feelings or to see things with a different perspective without getting overwhelmed by fear. And sometimes the plant medicines don't do that quite so much. Like if you are kind of resisting or getting
Yeah.
stuck in fear, it will be exacerbated because psychedelics are non-specific amplifiers. But ketamine has a way of kind of being a bit more gentle. Now, it's an intense drug, especially if you do it in intramuscular, but it's a gentle intense. I don't even know if that makes sense, but it is kind of safer. So it allows people to have this different perspective, which sounds
So
like very
you're
wild, but
so like walk me through a session. Like
yeah.
what does it look like? Because you're also, and I'd love to know how you feel that it like complements traditional therapeutic.
Yeah. So, I care a lot about how this work is done because I think there's a lot of ketamine clinics that like stick people with
Hmm.
an IV and put them alone in a room. And
Yes.
that may benefit some people. And I also know that it harms people because we treat those people. So for us, this is relational work. It's not really even about the drug. The drug gives us access to things, shows us where we get to do the work, but this is relational work. So I work in conjunction with a therapist. I always have. And we spend a lot of time with our clients. So you're going to get a medical evaluation, you're going to get a psych evaluation, you're going to get preparation sessions before you even have medicine. The medicine sessions are 2 hours in person, and the experience itself is going to be about 50 minutes. But when you come into the session, we're going to do all the medical things first, make sure it's going to be medically safe. And then we kind of shift into more ceremonial type spaces. So we're going to talk about intentions. We may do a card pull. I usually do a reading, usually from the Book of Awakening, before I do an injection. You'll have an eye mask on, headphones. We curate our playlists. And then you're kind of in that space for 50 minutes. And either myself or the therapist I work with, Morgan, is in the room the entire time. So nobody's ever alone. And that's
Mhm.
part of the healing itself. So we talk about what the drug does physiologically, but part of the healing is having somebody be in it with you. So if something gets hard, if something's emotional, some of the emotions we may have shut down, anger, fear, sadness, if we can feel those and feel okay to feel those and then have someone witness it, that in itself is a corrective experience. And so when people come out of the experience, we begin integration. And what that means is kind of they share what they remember. We may ask some questions. Morgan is a licensed social worker. So sometimes she does more therapy and low dose ketamine, so like psycholytic work. And then the next day they may be doing more integration. So we are very integration focused rather than
Mm.
experience focused.
Yeah. I mean, integration is key, right? Now, so that's really, I find that super interesting. Do you inject it into the muscle?
Yeah, so at our clinic, we predominantly do intramuscular injections. So I do it in the arm, but sometimes we'll utilize sublingual ketamine as well. So,
Hmm.
this is really where you have to individualize your care. So if you're
Hmm.
going to just give everybody an IV and in the same dose, not everyone's going to be okay with that. particularly people who may be in different phases of healing or trauma work, right? So in paying attention to, are people dysregulated or not? Like, where are they at? The intramuscular injection has a pretty fast takeoff. So it comes on quickly, and when it comes on, it takes you right in. So not everybody is in a space where that's going to be the most supportive for them. So we may use sublingual, and that has a more gradual onset.
Mhm.
And we can often doesn't go quite as intense or as deep. It can, but so we really kind of tailored to the people that we're working with, but predominantly we use intramuscular.
And for like yourself to
Mhm.
do this therapy, did you need to have a medical degree?
To get access to ketamine, you do. Now you
Yeah.
could be a nurse practitioner or, PA, depending on states and all that. But yes, to get ketamine, it is a controlled substance. So you have to have someone with a controlled substance license. And then I always choose to work in conjunction with a therapist. Um, I think everyone doing psychedelics, regardless of why or where, needs integration, period. Most
Yeah.
people also need some therapy.
Oh, I think we need it all, right? And I think
Yeah.
it's so interesting to see where we're heading as a collective.
Mhm.
And I think it's wonderful. Like I microdose ayahuasca in the mornings because that helps me. Like that's been something I don't do it all the time, but it's just something that I've tried some of the ketamine, like just the
Mhm.
sublingual, and it wasn't. You just got to find what works for you. I actually would be so interested. I wish you were like close to me because I would come for a session. I try everything.
Yes. Okay.
But I found that, where we are heading as a collective and with our healthcare system, it's like really nice. Like we're starting to really open up our eyes, and we have more doctors like yourself that are coming out and like really looking at this from a different lens.
Yeah.
So that brings me like, tell me about like journeys and like, I hope I'm pronouncing it right. And
Yeah.
like, tell me about like the mission for you and your why.
Yeah. So it is. It's journeys. It's a play on words.
Mhm. That's what I thought.
Yeah. And, it is, how do we create more ease in our life, right? And we are a kind of more integrative ketamine practice. So I never refer to us as a clinic because that has something that I'm not interested in. And it really is kind of more holistic, comprehensive. So because we partner with my friend's therapy company, everyone's getting therapy with their ketamine. We do group work because we believe we're meant to heal in groups, and not everyone's ready to start there, but it really is very powerful for people to heal in groups. The main goal of why I do this is because I see it actually help people. And in a way that people start to believe and feel empowered that they have a role in their own healing, which is quite opposite often than Western medicine, where it's like we do as doctors or nurses or any providers, we do to people, right? Like I give you this prescription, I do this surgery, and like I'm the doer. And that really is disempowering for people. And then
Yeah.
sometimes that's the case, right? Like I don't want patients doing their own surgery. Like this, it's necessary in sometimes, but it really takes away all of their power. And what this work
Mhm.
does is really empower people. And to me, it's really about ethical care, quality ethical care, which I see is really being lost in the ketamine space when people see an opportunity for money. So, like, to me, I do this because I think it helps people and I care about people having that opportunity. Um, and it's about communities. So like I don't think that as providers we're meant to do this on our own. So when I see therapists working in their office by themselves with lozenges or IV clinics just sticking people in a room, that to me is not the way this work is meant to be done. It should be done in collaboration.
Mhm.
I know different things than Morgan does. Morgan knows different things than I do. We have two different perspectives and we work together. That benefits us as far as providing care, but it also really benefits the people we work with. So
Yeah.
to me, that's why it's really important. And we've started to open up, besides just ketamine, is like doing other practices that help to regulate the nervous system.
Yeah.
So, not separating mind and body like we like to do. It's all just one, right? Our body affects our mind affects our body. And how do we get people more embodied? and feeling safe there instead of living here up, which we do in this society. And so somatic work, breath work, actually you're going to start doing stellate ganglion nerve blocks to reset the sympathetic nervous system.
Ooh, what's that?
Oh yes, I'm excited about them. So
Yeah.
it's actually it's our stellate ganglion is in our neck, and a ganglion is kind of a collection of nerve cells, and it's part of the sympathetic nervous system. So sympathetic is our fight or flight system, which a lot of us live in an activated state of that, and
Yeah.
that chronic stress causes a lot of negative things for mind and body. And this has traditionally been done for pain, for chronic pain, but it's also more recently been studied with PTSD and symptoms of PTSD. And what it basically does is you use an anesthetic to kind of put around that little collection of nerves, and it numbs them for a few hours. And what it allows is kind of a reset of that system. So usually it's hyperactive in people who have PTSD. That's why they have this like hypervigilance. They're always kind of on alert, and it can kind of reset that system so that it can relieve some of the symptoms, such as kind of anxiety and hypervigilance. But it also has been shown to be helpful with like brain fog, so treating symptoms of long COVID, and I think just treating anxiety in general.
Yeah.
The more we use some of these things, the more we recognize that like it's not diagnosis based, right? It's kind of nervous system based. So yeah, we're trying to focus people on really supporting their nervous
Nervous
system
system
and being.
regulation.
Mhm.
Yeah. I mean, that's the key. That
Yeah.
is the key. And I loved what you said. I was like smiling and nodding. I loved what you said about empowering because I feel like the way that our current, healthcare system is set up is like if you're not advocating for yourself, you're at a complete disadvantage.
Yeah.
And I think that, and what I always tell people with my work is like all healing lies within, right? How do we come back to that place of safety,
Yeah.
like you mentioned, and where we have a regulated nervous system so we can start to access the parts of ourself that are the truest, the most authentic, and really the ones that like have our gifts. Like, how do we unlock those
Yeah.
like hidden treasures inside of us? And so I really am aligned. I was really excited to have this conversation. I was like, oh, this is going to be very interesting because, like I said, I've seen bad things with ketamine,
Oh yeah.
but I really love that like your intention and your ethos is very aligned with mine. And could I ask you what you have found to be the like what is ketamine best for treating? Is it like trauma? Is it anxiety, depression, suicidal thoughts? Like, do you happen to know?
Most of the research has been done around depression and specifically treatment resistant depression. But again, I find it helpful for all of those. So I'd say actually more people are presenting with anxiety these days. I think people have usually a combination of both. It's not like one or the other, depression, anxiety. It's kind of both. Um, but with the way the world is and what is happening in the world, there has been, and for a few years now, right, a lot of anxiety, which makes sense. And it can be really helpful in that space. I do think it's really good with trauma, and using it differently depending on people where they're at in that trauma. The idea of safety is that sometimes people don't even know what that feels like, right? Like they have no memory of safety. And so it can help kind of give them that reference point. To me, this is all like a returning, right? Like ketamine doesn't give you anything. It's just like
A
showing you what's inside
remembrance.
you.
That's right.
And it's like we forgot, right? And this is all humans have the ability to feel safe inside. We just, when that gets fractured or not supported early on, we forget. So I really think that all of these things have been supportive. I think where we get a little bit, where it could potentially not be as helpful, or you have to be a little bit more cautious. It can help acute suicidality. It can help people kind of stop that, disrupt that. More chronic kind of personality disorder types, maybe chronic suicidality associated with personality disorders can be a little bit trickier. It may, and this is where we also have this pop psychology where everybody's a narcissist and everybody's borderline. We all have traits of those, right? So there are personality traits in this cluster A, B, and C. But to have a true personality disorder is actually quite rare. So we're misusing that terminology. But when people have stronger traits and they may potentially qualify for a true personality disorder, the thinking patterns they have are very rigid. And so it may take longer to disrupt those. You may have to go slower. And there are some that it may worsen. So, like true narcissistic personality disorder, which again is rare, um, you may actually inflate some of their beliefs and make them worse. So,
Mm.
and so you have to be really cautious and you have to trust your gut. This is another reason why it's good not to work solo. There are some people that, you do the interview and you're like, this doesn't feel like it's going to be a good situation for them, right? Like it's never about like, can I give someone ketamine? I can give anybody ketamine. Is this actually going to help them? Or
Hmm.
am I going to destabilize them, right? Do they have support? Are they in like an abusive situation? Are they home? Like, you don't just give psychedelics to anybody. So, like, I think, kind of all of those things you have to take into consideration when you're assessing, is this going to help somebody now in their symptoms? And sometimes we tell people, like, it's not a no, but like, not right now. Like, we need you to do
Yeah.
some more therapy work. We need you to get some more support in your life. So I think that's just as important as to like what is actually their quote unquote diagnosis.
Yeah, I think that, education, as you said before, like education is super crucial. So, like, for someone who's considering to do this, so
Yeah.
what would be like key information that a patient needs to be informed prior to their treatment? I would love to know what they need to know. And then I would love to know, like, what do you need to know as far as your protocol? Like, why would you turn people away? Maybe
Yeah.
they're like, are there certain conditions, schizophrenia, borderline personality, using drugs, that sort of stuff?
Yeah. So, I mean, I agree. I think popularity is rapidly outpacing education, and that's where people are going to get in trouble. For me, education is key. So, what people need to know in general is that the medicine doesn't do the work for you. Like, ketamine is not a cure, nobody's broken, and it doesn't just come in and quote unquote fix you or take away your feelings or just get better. So, if you look up ketamine and you Google things, people talk about, oh, depressive symptoms are immediately better. Sometimes. And also, usually what we see, and we kind of have developed our own protocol, but people will feel better and then they feel worse and then they feel better again. Because essentially, what we're doing is allowing them to feel comfortable. As they feel comfortable, they'll go deeper into their subconscious. They will unlock the things we've been hiding away, the emotions we're trying to block, and that won't feel amazing. But then if they do the work and get to the other side, they feel better. So it's really clear for people to know that it's not just like fun and easy. It doesn't do the work for you. It shows you where you need to do the work and gives you access to that. It also is time consuming. So like we put a lot of time into our clients and we're asking of them to put a lot of time in. So you're going to get out of it what you want to put into it. That's important. And it is important to kind of recognize sometimes it may feel like it blows up your life a bit. As you start feeling things, as you address relationships potentially in your life, as you prioritize yourself and disrupt the way that people are used to interacting with you, things can change and blow up in some ways. And, we encourage people not to make major decisions, life decisions, and, until we've kind of worked through and given them time. And for us, they need to have a therapist. So
Yeah.
they work with Morgan when we work together, but they need to have an outside therapist because this can be destabilizing. And we need to know that they're supported. Um, and yes, they need to have like kind of support outside. Like they need to have like some type of stable living situation. Um, they can't actively be using substances. So I do think ketamine can be useful for substance use disorder. It can also be a way for people to escape. So you really have to assess who you're working with.
Yeah.
If they're actively using substances, I need them to not. I don't usually work with those people. I am not trained in substance
Yeah.
use, so I think they're better served elsewhere. If they're using a lot of alcohol, depends on how much, and can we kind of work with that to help them decrease it. My evaluation is often a combination of medical, because I need to know certain medical conditions. If you have severe heart or lung conditions, that's probably going to or high blood pressure may exclude you, not always. But then I do kind of a psychosocial examination. So like I'm asking people about trauma, to what degree they feel like sharing. I ask them about their relationships with current partners, but also with their family. So I want to know where they came from. I want to know why they are who they are. And that's important to me. And then I trust my intuition. So like I just can get a sense sometimes. And there are some times where I'm like, I really want this to help this person, and I'm going to take the risk that maybe it will work out for them and maybe it might not. And I feel okay that I can support them if it doesn't. But it's a lot of really just, are you ready to do this? Like I
Mm.
never ever try to convince anyone to do psychedelics ever. I'm happy to give them
Yes,
all the
absolutely.
information and tell them if I think it will be helpful, and then they have to want to do it.
Absolutely. You must be called, right?
Yeah.
Now, we were talking about integration before. I would love to know, like, what sort of challenges have you run into? What are like common challenges that people might face during the integration process?
Yeah. So, I think first of all, people don't know what that means, right? So if you ask someone what is integration, you'll probably, if you ask 100 people, you get 100 different answers. To me, it's really like, how do I take the experience? So whatever insights, feelings, emotions that I got during the experience, how do I then make meaning for them in my life? So like we don't tell people what it means for them. We help them figure out what it means for them. And then what does that mean going forward? Like what are the actionable changes I'm going to do? Because the goal is, how do I have that feeling, emotion, experience? How do I have more access to that in this reality without needing the medicine so much, right? So if I just need to keep going back to medicine, can't live in medicine space.
Yeah.
So I think it sometimes can feel hard to understand how to do that, and it's going to look different for everybody. The biggest struggle is people who want to logically figure it out. They want to know the things, tell me how to do it, and I'll figure it out, because we're used to living here, and it's never usually going to be logic. It doesn't have to make sense. It has to make meaning to you. Like very different, not
Mm.
logical. So it's usually going to come from body up, up um, from bottom up instead of top down. And that can be a really hard shift. And, working here in Utah, a big struggle that we see with kind of people who may have been part of the dominant religion here and kind of leaving that is really trying to figure out who they are and like
Mm.
understanding sense of self. And that can feel really hard. And that can take some work. And it's just kind of like trusting themselves. Like learning to trust yourself can be really challenging if you've never done it.
Yeah, absolutely. Yeah. And your identity, right? That's a
Mm-hmm.
whole thing to unravel when
Yeah.
you've been taught to be a certain way and it's this way, and then removing the dogma.
Mm-hmm.
Um, so, in your opinion, where do you see the fields of integrative medicine and psychedelic therapy evolving in the next 5, 10 years?
Oh, I mean, I have a hope.
Yeah.
I mean, I'll start with my hope. It's more promising. My hope is that like they are integrated, right? So like what would be really great is that psychedelic medicine becomes part of caring for self, right? So that we really do start to blend more of overall health instead of mental, physical, right? So like I think nervous system, inflammation, mitochondria are huge for all of our body. Like those are big things that affect very many aspects of our body that we need to kind of look at. And creating more integrative quote unquote clinics, right? So people can go one place and have multiple different modalities. The challenge there is cost. The challenge there is getting different providers to work together. Like there's a lot of challenges, but it really benefits everybody, right? Like, so I
Hmm.
should be able to go see my doctor. Maybe I get some
Absolutely.
labs, and then I can get a breath work session before I leave, right? Like having to go 17 different places and really is.
Like a collective, which is the environment that
Mhm.
like we're moving towards, like creating collectives. I
Yeah.
have an online collective too. Like, how do we create collective spaces? That's
Yeah.
how we change the healing and our healthcare
Yeah.
system.
Yeah. And Western medicine is really great at treating acute care. It is not meant to treat chronic care, which is why it's not great at it. It's not the way it's set up. We don't have, the time and skills, the insurance, the way everything's set up. It doesn't allow doctors to really spend that much time
Or
treating.
preventative care, which
Yeah,
is even more important.
yeah.
Preventative
So
and chronic,
it's kind of like Western medicine should be used for acute care, and it's the best it will be. Like if you need acute care, and then there should be another system that encompasses
Mhm.
kind of the rest, right? And not that they have to work separately, but we're asking too much of a system that's not meant to be there. So like, how do we disrupt this system, right? Like this is what psychedelics are in some ways meant to do if we go down the history, but disruptors, right? System disruptors. Instead of just trying to like plug holes, can we think outside of the box? And we have to think that way about humans, right? When we think about addiction, substance use disorder, when we think about mental health, depression, anxiety, trauma, suicidality, can we talk about it without putting these people over here, making people separate? So it's like we have to disrupt what we think we know is true.
It's happening.
Yeah.
And it is happening. And on that note, are there any resources or books that you would recommend for those who are interested in learning more about ketamine therapy, the benefits of psychedelics, or integration practices?
I mean, some of the like ketamine traditional books are probably not the easiest for people. You know, to me, there's everyone has probably, if they haven't read How to Change Your Mind, I think there's pros and cons to that book. I think that, you know, starting to think about trauma in a different way. Gabor Mate has a number of books that I think are very supportive. Peter Levine, Waking the Tiger. Rich
Mm-hmm.
Schwartz, parts work. So, everyone knows internal family systems. That's one way to do parts work, but people relate to it. So, no bad parts. Trying to think what else I'm a huge book person, so I have like 70 swirling. I think, if we start to change our mind around substance use and addiction, people should be reading Carl Hart's book, Drug Use for Grownups. Um, those are
Mm.
probably ones that I would say. And then you can get some more kind of philosophical type things in the psychedelic space. I mean, Stan Groff is, you know, a big, huge teddy bear and an amazing human, and he's done a lot of work in psychedelics. So I think it just kind of starts with curiosity. Like, why are you curious about, like, what are you looking to gain, right? And should
Mhm.
I be learning more about self? I think there's not a lot of great books around ketamine done well. I mean, um, Phil wrote the ketamine papers, but it's really aimed towards clinicians more than it is towards
Ah,
uh, the average kind of person. So, yeah, I think just kind of starting with like, why am I interested and what am I looking to get out of it? And then kind of go down that rabbit hole.
yeah, those are amazing books. So guys who are listening, make sure you get those books. And as we close out here, I would love to ask you, what is one lesson or message that you want our audience to walk away with today?
It doesn't always have to be hard. We value the struggle, and we think that healing comes through pain, suffering, grieving, fear. And in some ways it does. But with everything, those only exist in contrast to joy, love, ease. And those are often much harder for people. And so
Mm,
knowing it doesn't always have to be hard. We can do hard things, but we also have to invite in the play, the joy, and the love, or we're never going to get where we want to be.
I love that. And where can people find you online to learn more about your work and book a session with you?
Our website is www.mymyjourneys, journease.com. And same with Instagram, it's my.journeys for Instagram. And you could always email me at stephanie@myjourneys.com.
Amazing. Thank you so much for being here today.
Yeah, thank you for having me.
And I can't wait to continue our conversations. Guys who are listening in, stay tuned, and I'll make sure that I have all the links for Dr. Stephanie's info so you can reach out to her. See you next time.
Thank you.
Thank you for listening to this episode of Divine Lifestyles Podcast. Don't forget to subscribe, rate, and review us wherever you get your episodes. If you really loved this episode, screenshot it and share it on social media. It will help us to continue to make an impact. With gratitude and love always, keep illuminating your path.